Hey guys, today we're going to break down yet another paper proving that in fact it is possible to enlarge your penile tissue. And so this paper was published in 2015 in a peer-reviewed journal, and so it is some of the highest quality evidence that we've come across for penis enlargement. And so today we're going to break it down and talk about what we can learn from it and how we can apply it to ourselves, so stay tuned. Hey guys, so today we're going to be talking about this paper. The paper is titled Applying Extender Devices in Patients with Penile Dysmorphophobia, Assessment of Tolerability, Efficacy, and Impact on Erectile Function. Basically what this paper is looking at is a group of guys. It is a prospective cohort data, and so there's lots of different tiers of evidence, guys. I'm not going to kind of perseverate on the different types, but obviously the best type is when you have a double-blind, placebo-controlled randomized trial where you have one group over here and then another group over here, and neither the participants nor the people running the trial know who gets what. It's not possible for most of these penis enlargement studies, guys. It's just not. And so we have here is a prospective cohort data. So for those that know, I'm conducting my own little unofficial trial on Reddit. It's called the HINK trial, and it's going to be a group of guys that we're going to study one specific outcome moving forward from a certain time point. That's what they're doing here. It is important to know that this isn't like some of these other studies where you can have guys with like Peyronie's disease or other types of penile-related disorders that then apply penile extenders, like guys with prostate cancer. This is an otherwise healthy group of guys that are using penis enlargement techniques to see whether or not it works. And so, introduction to this paper. And so, guys, I have the, I'll put the link below to this paper, but I've said it before, if you're only reading the abstracts, you're missing like 80% of the important stuff. And so, especially in the introduction and the discussion is where a lot of the detail is. And so, in this particular paper, they're talking about basically what is penile dysmorphophobia. Basically, it's a component of the dysmorphia. So everybody knows basically what body dysmorphia is, and it's when you have a perceived, and so not a real, but a perceived flaw that is either imaginary or trivial, but it leads to significant impairment in function. And so a key thing when you're talking about like the ICD-10 definition, which is basically like the billable diagnosis code for those not in the medical field, is that there has to be an impairment of outcome. And so, for example, guys often will become reclusive, or they will limit their dating life, or just have significant anxiety as a result of having this disorder. And so just thinking you have a small penis isn't enough. It really needs to impact your life. And so, guys, I've said it before, I'm guilty of this. Guys, even when I was, I started off above average, I absolutely had borderline still have this disorder where I just assumed that I was too small and I thought it should be bigger. And it did affect actually the type of girls that I would date. It affected the type of movies that I would see. It definitely affected my life. So it's a real thing. And there is counseling, guys. There is things you can do about it, but that's another video for another time. Also in this introduction, they talk about why not doing surgery, and they talked about how ineffective it is and the severe complications, and how things like when you cut your suspensory ligament surgery or like penile ligation surgery of the suspensory ligament, you do not have actual enlargement of your erect tissue. You just have enlargement of your flaccid tissue, which I've talked about before. And so they don't recommend surgery, and so they wanted to have a reasonable substitution for this. So guys, if you made it this far in the video, I certainly would appreciate it if you give me a thumbs up and even consider subscribing to my channel. It would mean a lot for me and help the channel grow. And so as far as the methods, what they looked at is initially they had a group of 163 men that basically went to the urologist complaining of a small penis. They did not include these men that actually had, by definition, a micro penis, which is below about 3.1 inches erect, okay? So these were men within a normal penis range that just had this small penis syndrome. All the patients on the study got counseling and reassurance that their size was normal. And then of those 163 men, only 54 men enrolled after learning what basically they were trying to study. Of these, 4 were ineligible due to psychiatric issues, and 6 did not complete the study. So that left, of the 163 men that were basically saying, I think my penis is small, this is devastating my life, only 44 of them remained for the study. So that's 25%. And so there's always this debate about, will PE ever be mainstream? No, it will not. If we're talking about these, we have a group of 163 men, and only 25% of them actually have the gall to do what it takes to actually do something about it. You don't have to worry about this being mainstream. It's too hard, guys. It's too much time. In this study, they're talking about wearing an extender for 4 to 6 hours a day. Most guys want a bigger but they're like, no, I'm not willing to do that for it. You don't have to worry about PE becoming mainstream as demonstrated by this study. And so a big shout out to all my PE warriors out here that actually feel like they have a small just want a bigger whatever it may be, and are going to do what it takes to get this stuff done, because not everybody has what it takes to do it. Moving on, when we're talking about measurements, all the measurements, well, they measured the flaccid stretched, and they measured the erect. And so they actually had an examiner or a trained examiner measure the stretched flaccid length and the flaccid length for all these participants. They did train the men on how to take an erect penis picture, and so they did have the participants take those themselves, so that is important to note. Also of note is that the extender they used, which I'm not going to put the name in here because it doesn't matter, but it exerted between 600 grams to up to 1.5 kilograms of force, and they required the participants to wear it 4 to 6 hours a day. And so, guys, if you're ever considering doing any kind of enlargement, blood flow is key to keeping the tissue healthy. There's been proven on clinical trials to maximize what we call your endothelial function, or the little cells that line the blood vessels in the penis to keep it healthy. And so one of the ways you can do this is, can anybody guess? Of course, I'm going to bring up Vigor, guys. It's a great product. It's clinically proven. I won't take too much time on it, but you should check it out. We have our second batch. It's honest to God about to sell out, guys. So if you're interested in it, you really need to move on it soon. Available on Amazon, available on LeviathanSubs.com, okay? So as far as results, guys, as you can see here in figure 1, at 6 months, the mean gain was 1.7 centimeters in flaccid length, 1.3 centimeters in stretched flaccid length, and 1.2 centimeters in erect length, all of which were statistically significant, or p-value for my science guys out there. Okay, the p was less than 0.05. There were no significant girth changes. Most of the gains, as you can see once again in that chart right there at figure 1, took place within the first 3 months. And so what does this suggest? It honestly suggests that newbie gains thing is real. That the biggest and most impressive gains are going to happen within, honestly, the first 3 months, according to this paper. 65% of the guys on this study reported an increase in erectile function. And when they actually looked at an extended population, so they took the guys that did the study, 23 of them, and looked at a mean of 32 months followed up, and there was no significant decline in either the flaccid or the stretched penile length. So what does that mean? It means that the gains were permanent, even at a significant time after the study was concluded. And there were 4 patients on this group that were initially excluded from that study because they had significant pain and discomfort. But the good news is once they stopped, all the pain and discomfort was reversible, so it was safe. And so when it comes to discussion, they always say that there is a modest gain of 1 to 2 centimeters in flaccid and erect length. I mean, I don't know about you guys. There are certainly guys on the subreddit that say, how can I get, I want to get 3 inches. And I always say, you have to have realistic goals. I've said it before. When I started my PE journey, I would have done anything for 1/4 of an inch. I would have been out of my mind happy with 1/4 of an inch in length. And so in this study, they're talking about, in 6 months, they saw 1.2 centimeters, which is literally 1/2 an inch in length enlargements. And it actually it had a range of up to 1 inch in this study in the first 6 months. But I mean, I don't consider that modest. Maybe you guys do. And so, if you were to gain 1/2 an inch in 6 months, and that would be only a modest gain for you, or, even 0.25 inches, 1/4 of an inch in 6 months, and that wouldn't be worth it to you, then I don't think you need to do PE, because it doesn't just happen overnight. It's years and years. For most people, there are some hyper responders out there before you get these really significant gains. And so that's what they demonstrated here. I think that it's safe. There were no serious side effects on this study. The study was only looking at extenders, but you can do it safely for even up to 6 months, okay, if not more. And so I think most importantly, guys, this is definitive evidence to me that this works. It's possible to enlarge. I pull out my hair. I don't anymore, but when I go to I just see these people that are just, even in the comments here, they're, the penis enlargement doesn't work. It's not possible. Everybody knows it's not possible. But it's like, guys, you don't even have to look that hard. You go type in PubMed and type in penis enlargement, non-surgical penis enlargement, and you will see that there's actually lots of published papers, including this one, showing that this works. And so it's where do these guys get off? And all the guys on that small problem subreddit, even big problem subreddit, you go in there and say, yeah, you can enlarge your penis, and you will immediately get downvoted to oblivion. I mean, I appreciate guys who are trying to promote it. Obviously, I'm trying to promote it just because I want other guys to have that peace of mind mentally like I had when I was actually able to get over my dysmorphophobia because of enlarging my penis. But, I don't stress it anymore. It's not worth getting in these debates, guys. So don't stress it. If anything, you can say, look, here's a published paper, peer-reviewed journal article, prospective cohort cohort trial showing that this works, and just leave it at that. And if they want to, find every little flaw or every little, whatever they want to say that it's not working, then that's on them, guys. You can lead a horse to water. You can't make them drink. I told 6 of my close friends about PE and about my results, and only one of them tried it, and he does it intermittently. The rest of them basically either don't believe me or it's not worth it to them, which, good on them. I'm happy they're content with where they are. But there's other studies, guys, like, I'll put up a study here, which I've talked about before, either on Reddit or on, my YouTube channel. But the conclusion of this paper is non-surgical interventions are not inferior to surgery. So traction devices like extenders or like hanging or even manual stretches are not inferior to surgery as far as outcomes. So there's literally a lot of evidence out here, guys. And this is just one additional paper. So anyways, guys, take this for what it's worth. I thought this paper was great. I'll put a link below. The PDF is kind of hard to find, but if you come on our subreddit are getting bigger, I'll try to link it on there so you can actually read the full paper if you can't access it yourself. If you need to reach me, you can go through my Patreon, Doc Hink. Finally, guys, this is my opinion based on my conclusion of this data. I always tell people, do your own research, form your own conclusions. Don't take my word for it. Look at the paper yourself, analyze it yourself, and do your own research. Please check out some of my old videos. I'll put them up on the screen as the video closes, but I appreciate you guys. I wish you all the best. Good luck on your enlargement journeys, and I'll talk to you on the next one. Peace and love.